So I'm an ER doctor, and I got a story of the scariest moment I've ever had as a doctor. Several years ago, I was working in the ER, and we got a call from labor and delivery. They needed a doctor upstairs stat. Now, we didn't cover deliveries, and they didn't call a code blue, so I was a little confused, but I went up there anyways. When I got up there, they pointed me to the operative suite where they do C-sections. I walked over, peeked my head, and I see a woman fully prepped for a C-section, as well as an anesthesiologist, 2 OB nurses, and a NICU nurse. I'm like, hey guys, what's going on? The OB nurse tells me, well, she was in active labor. She already had an epidural. We were waiting for her OB doc, and she started to have late D cells. Now, what this means is with each contraction, it pinches the umbilical cord. This causes lack of blood flow to the baby, and the heart rate dips down until the contraction's over. This is a life-threatening thing for the baby and indication for an emergent C-section. So the OB nurse had called the patient's OB, Dr. Smith, who said, prep her for a C-section. I'm on my way, but he was still about 10 minutes out. Now, I'm an ER doctor. We don't do routine C-sections. I've never done one. I watched a couple in med school, but as an ER doctor, we're trained basically to cut babies out of trauma and CPR victims in which the mom's life is pretty much already passed. So I tell the nurse, well, I'm the ER doc. I don't know, what I can do in this situation. She said, I know, I just have a really bad feeling, which gave me a really bad feeling. So I go to the head of the bed and I'm reassuring the patient, listen, your baby's heart rate right now is 120, which is where we want it to be. You want it to be above 110. So Dr. Smith, he'll be here in about 10 minutes. He'll get this C-section done. Right now your baby is stable. And she's like, okay, we're talking for maybe another 30 seconds or so. And then I hear the OB nurse go, oh shit. And I look up and I see 100, 95, 90. 85. I look down, the patient's starting to panic because she could see and hear the commotion. What's wrong? What's wrong? And I said, your baby's heart rate is dropping. Just give it a second. Let's see if it comes back up. 80, 75, 70. I look up the OB nurse and she said, you got to do something. This baby's in trouble. You got to do something now. I look over at the anesthesiologist and he goes, so I look back down at the patient and she said, please help me. Do whatever you got to do. Please help me. Please help me. And I think, oh my God, this is actually happening. So I rush over into position. I slap on some gloves really quick. I grab the scalpel. I look at my field and I'm like, oh God, my hand is shaking. Take a deep breath. Crap. Make the incision through the skin. Make the incision through the rectus abdominis muscle. I've got the uterus exposed. I make the incision through the uterus. I get the head out. There's no cry. Grab the suction them out. There's still no cry. Try to get the shoulders out. They're stuck. They're stuck. Take the scalpel, extend the incision, get the shoulders out. Get the lower half out. The OB nurse clamps the cord, cuts the cord. There's still no cry. I pass the baby over to the NICU nurse, and then the OB doctor peeks his head over my shoulder and goes, hey, that looks pretty good. I look over at him like, oh my God, dude. And then I hear the most beautiful sound I've ever heard in my life. The baby cries. The baby fully recovered, the mom fully recovered, and I'm still recovering today.